Hey everyone, welcome back to the channel. Today we're talking about a blood disorder called methemoglobinemia. So what is methemoglobinemia? Well, it's a rare blood disorder where your normal hemoglobin, the stuff that carries oxygen in your blood, gets oxidized into something called methemoglobin. And here's the problem. Methemoglobin is terrible at carrying oxygen. It's like trying to transport passengers in a car with no seats. Useless, right? The result? Less oxygen gets to your tissues, and your body starts showing some very strange signs. Now, how does this weird blood condition even happen? Well, it can be either congenital, meaning you're born with it, because of a genetic enzyme deficiency, like a problem with something called cytochrome B5 reductase, or it can be acquired, which is way more common. Certain drugs like benzocaine, which people often use as a throat spray, and medications like Daspon can trigger it. Even contaminated water with high levels of nitrates can cause your blood to turn chocolate brown. Now let's discuss the clinical presentation of methemoglobinemia. The hallmark feature is cyanosis, particularly noticeable in the lips, nail beds, and mucous membranes. This occurs due to impaired oxygen delivery to peripheral tissues. Another key diagnostic clue is the presence of chocolate-colored blood, which retains a dark brown appearance even when exposed to oxygen. Patients may present with nonspecific symptoms such as headache, fatigue, dizziness. These symptoms typically correlate with the methemoglobin concentration in the blood. At higher levels, generally exceeding 30 to 40%, patients can develop neurological symptoms including altered mental status, seizures, and potentially coma if untreated. How do we confirm it? First, suspected based on the clinical signs. Blood looks dark brown and won't turn bright red with oxygen, which is unusual. Pulse oximeters tend to give a reading around 85%, no matter how much oxygen you give. That's a red flag. To be sure, we use co-oximetry. It directly measures methemoglobin levels and can tell it apart from other abnormal hemoglobins. The main treatment when symptoms are significant is methylene blue, given intravenously at 1 to 2 milligram per kilogram over 5 minutes. Methylene blue helps the body's enzyme convert methemoglobin back to normal hemoglobin. Of course, you need to stop whatever caused it, like a certain medication or chemical. Thanks for watching. If this video intrigued you, don't forget to like, subscribe, and join me next time as we uncover more mysteries of medicine. See you next time.